Number of white blood cell. Number of white blood cells are obtained with the use of complete blood count, or also known as CBC. CBCs are obtained with the use of course, the blood sample from the patient, and these cells are counted with automated cell counters. The blood cells that are being tested in CBC would be red blood cell, white blood cell, and platelets. Red blood cells are also known as erythrocyte, and if you have a low amount of red blood cell, a person might be suffering from B12 deficiency, folate deficiency, and could also have anemia. The number of red blood cell could be affected in females if they have excessive bleeding caused by menstruation. Next one, white blood cells. White blood cells are also known as leukocyte, and white blood cells are evaluated per type. Okay? And the types that we have are we have neutrophils, we have lymphocytes, the B and the T, the basophils and eosinophils. We did not really talk about this one before because it's not required of the syllabus, but for extra knowledge, basophils are white blood cells that are responsible or are used during inflammatory reactions and possibly during allergies. Eosinophils, on the other hand, are responsible for combating multicellular parasites and certain infections. Monocytes are the immature version of macrophages. So each of these are counted in a CBC. Note that their numbers shift depending on the condition of the immune system. For example, neutrophils, their numbers shift because a person might be experiencing bacterial infection or maybe they have inflamed tissues. Lymphocyte, on the other hand, might be caused by viral infection or tuberculosis. And also, lymphocyte is the one being affected if a person is experiencing HIV infection. And lastly, we have platelets or thrombocytes. This is responsible, or this is a fragment of a red blood cell and is mostly responsible for blood clotting. Blood clots help us or help our body prevent excessive blood loss. Once a complete blood count is done, depending on the result, of course, of the patient, the doctor might ask the patient to do a follow-up test to confirm diagnosis based on the displayed signs and symptoms of the patient. For example, they might ask you to do another set of blood work to check what kind of virus or what kind of bacteria that you have, and you might also be asked to do urinary analysis, wherein you're asked to pee on a small cup, and they would be testing it for some presence of other organisms, antibodies maybe, antigens maybe, or maybe presence of pathogen. The talk about complete blood count will not be finished without going back to stem cells. In here, you have a bone marrow that contains stem cells that are multipotent. Multipotent stem cells, if we have already forgotten, are cells that have the ability to self-divide and develop into multiple specialized cells present in specific tissue or organ. Most of the stem cells found in adult are multipotent stem cells, and In this case, we have the bone marrow, and the bone marrow stem cells are actually divided or classified into two. We have the yellow one and the red one. The yellow one is also known as the mesenchymal cells, which gives rise to bones, fats, cartilage, and muscles. The red, on the other hand, is known as
hemato or hematopoietic,
and this one gives rise to myeloid and lymphoid stem cells. Myeloid stem cells allows or gives rise to neutrophils, monocyte, platelets, eosinophil, and basophils, while lymphoid stem cells are the ones that gives rise to lymphocytes, which are the B cells and the T cells. So why is this now important in the number of white blood cell? If let's say there is an abnormal cell division, this might mean that the person is experiencing cancer, and the cancer of the stem cells in the bone marrow is known as leukemia. By definition, leukemia is the cancer of the blood or bone marrow. Leukemia can develop due to problem with blood cell production. It usually affects the leukocyte or the white blood cells. So in here, in leukemia, stem cells do not differentiate properly. So a person can have very low red blood cell, which will result to anemia, or then they can have excessive bleeding afterwards. Also note that in this condition or this disease, the stem cells or the undifferentiated stem cells fill up bone marrow, then flow into lymphatic system. The mature neutrophil and lymphocytes would be too low. Therefore, the person who has leukemia can experience immunosuppressed condition wherein they would have the tendency to get more infections. Do note that leukemia can even be classified into two based on what types of white blood cell are affected. The first one is known as myeloid, and the other one is known as lymphoblastic. So for myeloid, most that are affected are neutrophils. And for lymphoblastic, obviously from the name lympho, that would be for lymphocytes. If leukemia will be classified according to speed, there will be two names for it.
and that will be acute and chronic.
Acute leukemia would be the type of leukemia that develops quickly, and therefore there are more severe effects on the patient, and this requires immediate treatment. Chronic, on the other hand, takes years to develop. Therefore, the doctor can monitor the patient with the use again of complete blood count. And while they are doing treatments wherein there are several types, they would also be doing complete blood count in order to assess if it has any effect on the white blood cells, especially of the patient.